Good morning. Welcome to today's webinar on designing pre- and post-tests for program evaluation. It is just after 11 o'clock, so we're going to go ahead and get started. Thank you all for joining us today. We're really excited to be hosting the first in a 6-part series on evaluation, program evaluation basics. So today's webinar, Designing Pre- and Post-Tests for Program Evaluation, is being sponsored and hosted by Capacity for Health at the Asian Pacific Islander American Health Forum. We're a capacity building assistance program with offices in both San Francisco and Washington, D.C. And like many of the other capacity building assistance providers, we're actually funded directly by the CDC in order to provide free support, trainings, and one-on-one technical assistance. We work primarily with community-based organizations, and we do really broad wraparound services and support to help folks improve their programs, specifically HIV prevention programs. But we do work around all of the kind of organizational development needs like board development and fund development, strategic planning, as well as helping support organizations to implement very specific evidence-based interventions and public health strategies that the CDC is currently disseminating. And then finally, we do a lot of support work in the areas of monitoring and evaluation to help organizations better understand how their programs are working and how to improve those programs. So today's webinar and the whole 6-part program evaluation webinar series that we're launching today falls into this area around monitoring and evaluation. We'll talk a little bit more at the end of today's webinar about how to access further capacity building assistance. Like I said, we do trainings as well as providing one-on-one support, and we'll make sure you have contact information at the end of the webinar about how to contact us if you'd like more support in these areas. Just a little bit of housekeeping before we get started with our content. Everybody who's logged on to the webinar is automatically muted, and we will have opportunities for Q&A as well as discussion. There are 2 ways for you to ask questions or participate in discussion. One is to click on the hand icon that'll raise your hand, and we'll be able to actually call on you and unmute you so you can ask your question live. If your audio is through a telephone as opposed to through your computer, please make sure to enter your audio PIN. Otherwise, we're not actually able to unmute you if you want to raise your question live. You can also ask questions by typing them in using the questions feature. We'll be keeping an eye on those questions throughout the whole webinar. If you're having any technical difficulties, please type that in the questions feature. We can respond to that. And also when we do Q&A or discussion, there'll be an opportunity to ask questions and we'll be able to respond to them. If anyone's watching the webinar with multiple staff or colleagues on one computer, if you want to just type in your contact information in the questions box, that way we can include you on any follow-up, including sending out information and resources that we talk about during today's webinar. And finally, today's webinar will be recorded. So the recording will be available on our website as well as the slide set and some other resources that we'll talk about towards the end. I'm pleased to introduce our presenter today, Kristen Fernandez. I've had the pleasure of working with Kristen for over 10 years since she was a coordinator of an HIV prevention peer education program that I worked with. She's done a lot of direct service work in HIV prevention as well as doing a lot of program development, management, and evaluation. She's doing a lot of consulting these days, including with us, and when she's not developing, managing, and evaluating amazing programs, she is chasing around her 2-year-old daughter. So I'm going to go ahead and turn over the audio portion to her so that she can walk us through the content of today's webinar. Kristen.
Hi, everyone. Thanks, Sonia, for that introduction. Thanks for being here. So let's move right into our agenda. Today's webinar will be 1 hour in total. We'll cover the main content in about 50 minutes, and I'll do question and answer at the end of each section as well as at the end of the presentation. So feel free to type in your questions as they come up, or you can wait to ask them live. We'll start with a short introduction to pre- and post tests. That'll include what they are, how they are useful to program evaluation, as well as their limitations. Next, we'll go through the steps for designing a pre- and post test using a case study. Oftentimes, pre- and post tests are done in a questionnaire format, which is a great way to do them. But there are other styles of pre- and post tests that can be used as well. So we'll spend the last part of the webinar discussing these alternatives. And as mentioned, we'll have some extra time for question and answer at the end. I'll be answering both typed-in questions as well as facilitating live discussion. So before we get started, I'd like to take a quick poll. Please let me know if your program has ever used a pre- and post test before. In just a few moments, you'll see a pop-up on your screen, so you can enter yes, no, or not sure into the quick poll. So you can go ahead and enter the quick poll now. Great. So I'm seeing quite a few of you have used pre and post tests before, so that's fantastic. So this will be some new information for you guys. And for anybody who said no or don't know, you'll learn a lot today as well. Thanks, everyone, for sharing your experience. Okay, so we'll just give them a few seconds to get the slide back up. Great. So here are the learning objectives for the presentation today. By the end of the presentation, you should be able to understand what pre and post tests are and how they are useful to your programs, understand the limitations of pre and post tests, be able to form questions for pre and post tests based on program-specific objectives, be able to identify several alternatives to questionnaires, feel confident designing a pre and post test, and be able to define next steps for your agency. Okay, so let's get started with our first section. So what are pre and post tests? As you may have suspected from the word test, they are instruments used to measure a person's level of knowledge and skill as well as attitudes and beliefs about the program's subject matter both before and after participants participate in a program. So knowledge, skill, attitude, and belief are also known as behavioral determinants. This is because they are factors which determine or influence behavior. The subject matter we care about here is the one that your program is targeting to change. For example, if you have a weight loss program that's targeting to change weight, or you have an HIV prevention program that's targeting to change HIV knowledge, et cetera, et cetera. Pre and post tests are scored just like traditional tests, but the difference is that these scores are not given to the people who take the tests. Instead, they are examined and compared in order to give program staff an idea about how well the program is going. So pre and post tests are measurements that are taken at 2 points in time. Before the program, this is known as the pre-test, and after the program, this is known as the post-test. For example, before we begin an HIV risk reduction program, it might be helpful to know what a participant's knowledge of HIV is, what their attitude towards things like condoms are, or what they believe puts them at risk versus not at risk. After the program is over, taking a measurement of these same factors and comparing the results helps us to see whether or not any changes in these behavioral determinants took place. Pre and post tests are used in outcome evaluations, which are done to see if the program is meeting its intended outcome objectives. They are best for measuring short-term impact. So remember, we want to see what's happening as a result of the program. So taking these measures as close to the beginning and the end of the program is key. That way we can be more confident that any changes we see are a result of the program itself and not something that participants have learned somewhere else, like from their friends, at school, from TV or music, things like that. I also want to clarify here that post-tests are really different than follow-up measures. Programs can still do follow-up measures, for example, 6 months or a year after a program ends to see what knowledge or behavior is retained, but follow-up measures, while they're great to do, can't be considered a true post-test. Pre and post tests are also can be used to routinely monitor a program and provide feedback to staff or administration. For example, using a pre and post test after each session and looking at the results can help staff see if they're staying on target. Most often, pre and post tests are given in a questionnaire format. For the first and middle part of this presentation, we're going to talk about creating pre and post tests as a questionnaire. However, there are some alternatives, so we're going to talk about that at the end of the webinar. So as mentioned, pre and post tests are done as part of a program evaluation, specifically an outcomes evaluation. And here we can see the basic steps for designing an evaluation. Pre and post tests are part of step 4 of this process, the collecting and gathering credible evidence. In other words, the results of the pre and post tests are going to be used as the evidence that the program is working or not working, or which parts of the program are working and which parts are not. So let's take a look deeper into step 4 of our evaluation framework. On the left, we have the sub-steps of step 4, and on the right, we have a rephrasing of what this really means in terms of who, what, where, and why. The first step here is to decide what questions we want answered by using our pre and post tests. For example, we could want to know what the participants are learning or what behaviors are changing due to our program. In step 2, in terms of sources of the information, aka who will be providing the answers to our questions, we should decide if all participants or only some of the participants will be given the pre and post test. For example, if your program takes place over 6 sessions, you may want to specify that only those who have attended at least 4 of those sessions will be tested, because that way they've participated in the bulk of the program. How we gather information, sub-step 3, is through the pre and post test. We're going to show you how to do this over the course of this presentation, this webinar today. When and where we collect the information can vary, but usually pre and post tests are administered right before the program begins and right after it ends. Most often the pre and post tests are also given in the exact same location as the program activities take place. So as you can see here, pre and post tests fit nicely and can answer all the questions in step 4, collecting and gathering credible evidence. So they can be used to gather evidence for program evaluation. So the benefits of pre and post tests are that they're cheap, they're easy, and they're useful. They're very popular for this reason. Usually you just need a paper and a printer, and they can be passed out during normal program time. They also provide very, very useful information. For example, based on the results of pre and post tests, we may be able to see that certain sections of the material are really resonating or sticking with participants, whereas other parts are not. And this can help program staff fine-tune the program throughout. However, like with all things, there are some drawbacks to pre and post tests. The first main drawback is that pre and post tests cannot prove that any changes seen are due to participation in the program alone. Other factors in participants' lives can also be influencing the changes seen. For example, participants may have learned about material that is presented in the program from someone else or from something else like friends or television. In research, this influence can be reduced by use of a control group, as is done in randomized control trials. However, this is much more costly, and most programs don't have the funds to do this. Another drawback of using pre and post tests is that they generally rely on self-reported information. This means that the participant provides their own answers as they see it themselves. How accurate or inaccurate this self-report is called bias. For example, a participant might be tempted to respond to questions based on what they think sounds socially acceptable, not on what they actually know or what they actually do. Over-reporting how much they use condoms is a good example of this. So it's helpful to look at the statements on the next 2 slides to remind us of what pre and post tests can and cannot do. They can help us make an estimation of program effect. Notice here that we are saying the program influences, not causes, the change. They can't help us say definitively that a program can take all the credit for the changes we see because of the drawbacks we just discussed. But there are ways to design pre and post tests that can minimize these other factors. Things like good question design and administering the tests as close to the start and end of the program as possible can minimize bias and other influences from creeping in and skewing the test results. Okay, so let's take a couple minutes for questions. Does anyone have any questions so far? You can go ahead and raise your hand or type into the questions feature. Okay, let's see here. I see one. So I have one question that says, what's your take on information or knowledge retention over a long period of time? What can help clients with this? Sonia, do you have anything to add about this? Sonia, can you hear me?
Can you hear my audio?
Yes, I can hear you now.
Great. So I think when we think about information retention over long periods of time, there's a lot in adult learning theory as well as youth learning theory about repetition, and that information retention often has to be triggered in terms of repeat exposure. So there are programs, for example, that are really trying to influence knowledge and behavior change that in addition to the initial period of a program, let's say 4 weeks or 6 weeks or 8 weeks, and they might do a post-test right after the program ends. If they're going to be doing long-term measurement, like a 6-month or a 12-month follow-up, they might also include in the program design sort of a refresher session. So we've seen a bunch of the evidence-based interventions that the CDC, especially group-level interventions that the CDC is disseminating now, have that type of design where there's an initial program of X number of sessions and then a post-test to measure the immediate learning or skill or behavior or knowledge change. And then every month there might be an optional kind of ongoing check-in or refresher, and then they might do a 6-month or 12-month follow-up. So hopefully that answers your question. We'll talk a little bit more about some kind of creative ways for follow-up when we get into the alternatives to questionnaires. But if you have another question about that, feel free to blog it in using your question feature. I'll turn it back over to you now, Kristen.
Thanks, Sonia. And I saw another question pop up and then it went away about how long pre- and post-tests should be. And we're going to talk about that more in the next session. You know, it really depends on your program and the population of your participants, and piloting your pre and post tests, as we'll discuss, is really going to help you determine how long your test should be. Okay, any other questions before we move on? Great, so let's move into how to design pre and post tests. So to illustrate how to design a pre and post test, we're going to use the following case study. So your hypothetical agency provides weekly after-school HIV risk reduction workshops to teens. These workshops take place over 10 weeks. During these workshops, teens learn how to reduce their risk for HIV and other STDs through activities, skill-building exercises, and verbal and visual presentations. You will use pre- and post tests in order to quickly and cheaply gather info to assess the program's impact. The results will be used to refine the program and will be included in an upcoming grant application. Where do you begin? So we know based on this that we will be designing a pre- and post test to give to the participants at the beginning of the program and at the end of the program 10 weeks later, since it's a 10-week program. Here are the 4 steps for designing a pre- and post test. We're going to go through these step by step next. The first step to designing pre- and post tests is to look at your program's specific goals, objectives, and indicators. Usually these have been written out by program planners or managers. It's important to know what program goals and objectives are because these are really going to be the foundation of your pre- and post tests. They will give you an idea of what the program is hoping to change and what the specific indicators are that this change has taken place. Program goals and objectives are often found in logic models or in previous grant applications. If you don't know where to find goals and objectives for your program, ask a supervisor to help track them down. So really quick, let's take another quick poll. Please let me know if you know where to find goals and objectives for your program. Maybe you've seen them in a previous presentation or document, grant application, or maybe you just know who in the organization would have access to them. So go ahead and enter yes, no, or not sure. We'll just give it a few moments. Great. So I'm seeing about 3/4 of you know where to find goals and objectives, so that's fantastic. For those of you who said no or who aren't sure, that's your homework at the end of this webinar, is to try and identify who in your agency would know where to find these goals and objectives for your program. Great. Thanks, everyone. We'll just give it a few moments to bring the slide back up. Great. So going back to our evaluation framework, we can see that to be at the pre- and post-test stage, which is step 4, your program should have already developed measurable objectives in step 2 and thought of questions for evaluation, which is step 3. You'll need these to start designing your pre- and post-test, so be sure to find these by asking the appropriate person at your agency. This step is really important to do because agencies often forget to link their pre- and post-tests to these objectives, and they just design it based on what they want to ask. Sometimes this comes out okay, but sometimes we end up collecting a lot of information that we don't use and not collecting the information that we do actually need. So this is why it's important to be systematic in choosing what to ask based on goals, objectives, and indicators for your program. If your program doesn't have goals, objectives, and indicators to use in your evaluation, we're going to give you some resources at the end of this webinar to help in developing them. Okay, so going back to our case study, we have the following hypothetical program objective. We're just going to use one for this example, but a program will usually have several objectives. We're focusing on objectives now because they contain the numbers, which make them measurable, unlike goals, which are very broad and could be something like to improve the health of teams or something like that. An objective also has indicators, which define the objective even further. These indicators are very, very helpful for pre and post tests because they usually include the specifics that can be assessed. For this example, we want to know indicators of increased knowledge of HIV risk reduction strategies. For example's sake, we've made up the following 2 indicators. Can name 5 fluids that transmit HIV, and can list 2 strategies to increase condom use. Your program may have more or less indicators, and they may be different depending on your participant population. For example, if you're working with a population that is already very well educated about HIV, your indicators could be completely different. Just a word of caution, don't take an objective too literally by expecting to see the desired level of change reflected in each individual's pre and post test. For example, at the end of each 10-week session. It's important to look at pre and post test results from all your participants of the program as an average. This can only be done at the end of the program year after everyone who participates in all program sessions are done, like it's stated in the objective. So if you have several 10-week sessions over the course of the year, you want to wait until those are all done to average out the scores. However, that being said, if within a few months of your program, your pre and post test results are showing that much lower than 80% of your participants are showing improvement, you may need to tweak your program so that it is reflecting the desired impact. So that's an example of how pre and post test can be used to provide routine monitoring of the program at all steps of the way. I also want to point out something here that's a place where programs commonly make a mistake. Be sure to read the objective very closely and notice that it is not saying that it wants an 80% increase in knowledge, because that would be a lot. It's saying that 80% of the participants will have an increase in knowledge. It's up to your program to decide what a meaningful increase in knowledge is. Is moving from, say, 30% of their answers correct on the pre-test to 32% right on the post-test enough? Is that meaningful to your program? Or do you want to see a 10 to 20 percentage point increase, for example, in order for it to be considered meaningful? These are things to think about when planning your pre- and post-test, and they're really going to vary quite a bit depending on each program. Okay, so once you have your program's objectives in hand, you're ready to move on to step 2. You will use these to design your pre- and post-test questions. Try and design at least one question around each of your program objectives. These objectives can be phrased to ask the participants about themselves or about how others around them behave. For example, teens are often influenced by their peers or partners and how they behave, so you may want to ask questions about this to see how their peer group is doing. Some participants also might feel more comfortable answering the first few questions about what their friends do, especially when it's around a sensitive topic like HIV or sexual activity. So asking questions about others first can be a great way to warm up the participant before getting into more personal questions about their own behavior. So you want to use indicators to design wording of your questions. If you don't have indicators, think of what indicators might be for that objective and design a question around that. Again, we're going to give you resources on this at the end of the webinar, so you can that will help you design the indicators. In general, it's a good idea to have at least 8 specific questions in each section of your test and 3 to 4 sections that link back to program objectives. But this, as I mentioned during the Q&A, can really vary depending on your program. Don't require participants to remember super specific details. We just really want them to remember main concepts or points. And last but not least, be sure to ask questions where the participants should have heard a clear answer during the program. We're really not trying to trick people here. We want them to improve and we want them to learn, and we want our pre and post tests to reflect this. Keep in mind that we're assuming here that a questionnaire is being designed, but again, we're going to talk about alternatives to the questionnaire toward the end of the webinar. So in a few slides, I'll show you an example of this with a case study. But first, let's move on to common question styles. There are so many different ways to ask a question that it could be a webinar in and of itself. And in fact, we will be hosting a webinar on December 14th that goes into more depth about writing good survey and questionnaire questions. There are also tons of resources available on the web that can help you decide which question type to use and how to word your questions in the best possible way. We'll give you some links to resources at the end of the presentation today, but if you have a book on survey or questionnaire design in the meantime, that's also a great place to find more information about question writing. So first I want to introduce you to the two overall styles of questions that are commonly seen in pre and post tests. The first type of question is one where a question is asked and the participant is supposed to mark, choose, or write in an answer. This is fairly basic and done with the idea that a specific answer can be chosen. The second style of question is a little bit more complicated, but it can be really, really useful in pre and post tests. In this style, instead of answering, the participant is instead rating their knowledge, opinion, or feeling on a scale. This allows more flexibility and gray area in the participant's answer. We'll cover more about this in the next few slides and use some examples in the case study, but just to give you an overview. Now let's talk about common question types. In general, open-ended questions allow a participant to write in their answer. When you want a richer, more detailed answer, you might want to ask an open-ended question. For example, the answer to this question could, describe your day, could be something like, I woke up late, I was rushed, I cut myself shaving, then I missed my bus, yada, yada, yada. So keep in mind that open-ended questions, while they're great and they give a lot of description, they can be pretty difficult to score. In other cases, we want to know a specific answer, so we'll ask a closed-ended question. A closed-ended question will give the answer options below them, and the participant can either check them off, circle them, or something like that. Oftentimes in pre and post tests, we know exactly what we're looking for, so giving a limited set of answer options makes more sense. Sometimes we'll also see a combination of the two, where there'll be answer choices listed that can be checked off, but the last choice will say other, and then there'll be a place to write in what that other may be right next to it. The options that are given are usually the ones that are common, but here a participant also gets a chance to write in something that is more personal to them. So now let's go into more detail about the types of closed-ended answer options there are. Ordinal answers have an order that they go in. Ones we see a lot are strongly agree, agree, disagree, and strongly disagree. This is often used when asking about a person's beliefs and is worded as actually a statement, not a question, such as, I believe I am able to use a condom 100% of the time I have sex. This is also called the Likert scale, if you've heard of that. And here what we want is for a participant to state a certainty of knowledge or opinion or so on and so forth, rather than just mark an answer. Nominal answers are mutually exclusive categories, such as yes, no, or gender. Interval would be something like 0 to 5, 6 to 10, 10 plus. This could be an answer to something like how many partners do you have in a month, where we want to know a range and not necessarily a specific number. Intervals can also be used when asking about something demographic like age or weight. For example, are you in the 20 to 25 age range or the 26 to 39 age range? Are you 0 to 100 pounds, 100 to 150 pounds, etc.? If you want a specific number, not a range, like for a person's age or weight or what grade level they're in, that would be a numeric answer. Okay, so that was a lot of information. So let's go back to our case study now to show how to make questions based on the program objectives and indicators. So as you can see here, we've used one of the indicators to the program's first objective to guide the question. The indicator we are using has to do with the bodily fluids that transmit HIV. So we've formed our question around that. So we want the participant to be able to select all 5, but we've thrown in some other plausible answers so it's not too easy for the participant. In a real situation, we might have even more answer choices than this, and we also might include slang terms for these fluids that the participant might be more familiar with. We've selected a multiple choice format here because asking the participant to just remember all 5 bodily fluids and write them into an open-ended question format would be really difficult for most people. So instead, we're using a checkbox format, so we're testing their knowledge by having them differentiate the right answers from the wrong answers. And we also want to see if they remembered that there were 5 fluids altogether, and this was emphasized during the program. Okay, so moving on, here we've used the other indicator to guide the question for another question. In this case, we've chosen an open-ended format because there may be variation in the answers depending on the participant, and we really want to capture this. For example, if 5 strategies for increasing condom use are taught over the course of the program, the participant may choose the 2 that will be the most applicable to their own life. So we want to see here that the participant is thinking about applying these skills to their life. Keep in mind here how the participant might answer this question during the pre-test versus the post-test. Before the program, they might not be able to think of 2 strategies or even 1 strategy. But by the end of the program, we are hoping for them to easily be able to write down 2 of the 5 strategies that they have learned. So in other words, we really want to see an improvement. So once you have formed at least 1 question for each of your program's objectives, it's time to put these in order. And there is an order for questioning that has been shown to be the most effective in questionnaires. We want to start with sensory questions or descriptions. This will help participants remember about the experiences we're asking them about. Also, these questions are easier and less personal and therefore more comfortable for people to answer right up front. Then we ask about knowledge and feelings, and then next about opinions and values, and finally analytic or action questions. Analytic and action questions are questions that ask participants to think about scenarios and indicate how they would act or what they would do, how they would think through things, and so forth. It basically combines all the knowledge, skills, beliefs, etc. from earlier in the test into something participants can use in real life. And it's important to remember that these questions should come last because they're the hardest and they build on everything that was asked earlier in the test. So in general, you want to remember to go from easier to harder and from less personal to more personal when ordering your questions on the tests. This is important because you want to, as mentioned, give participants the opportunity to warm up because it's been proven that comfort and confidence increase over the course of taking a test. Here we can see how our case study question would be ordered if they were in a real pre- and post-test. The question on the left is a knowledge question, so it should come first. And the question on the right is an analytic or action question, so it should come later. So obviously in a real pre- and post-test situation, you might have 15 or even 30 questions. So you want to try and order them by the 4 categories we discussed on the previous slide, and within those categories, group them in a way that makes the most sense. For example, if there are 2 questions about something really similar, you want to put those next to each other. So the last step to designing our pre- and post-tests is to pilot them, and this is really important. Piloting means to try them out on people. We want to be sure to get as much feedback as possible from both staff and participants so we can revise the tests and make them as useful as possible. So as the designers of our tests, there may be flaws that we aren't aware of, and so having others try it out can help us fix these flaws. For example, questions could be too easy or too hard, the wording or format of the question might not be right, things like that. Also, it's really important to pilot with staff and participants. Other staff in your program can give you ideas about how to improve it in terms of content and from a programmatic perspective, like how to make the program objectives, make sure they're being addressed in the pre- and post-test. But it's equally, if not even more important, to pilot the tests with participants or people from the target population that your program serves. And this is because people like them are the ones who are going to be taking the test, so it's crucial to make sure that it uses the right language, that it's at the right reading level, it's at the right difficulty level, things like that. So going back to our case study, let's see how this program could pilot their pre- and post-tests. First, the program is piloted with staff, and they revised and piloted with participants before revising again and repeating the process. So your program may want to do even more revisions, and you can do as many as you want to get the instrument satisfactory to everyone. And don't forget, this is a great place to buy lunch or treats for people helping with your piloting. This attracts more people, and the more people giving you feedback, the better your testing instruments will be. Okay, so that was a lot of information. Why doesn't everybody take a moment to ask questions? So I see another question here. What would be a reasonable % increase from pre to post test when it comes to increase in knowledge? Again, that's really going to vary from program to program. It's difficult to say how much would be appropriate for your population. It really depends on what their knowledge is to begin with and how educated they are in the subject. Things like their education level, how many questions there are in the test, and things like that. So what I would say is to just make a target, say something like 5, 10, 20%, and really through piloting to try and determine whether or not that's a reasonable amount and to revise based on the results of your pilot. Okay, next question. Are true-false questions effective? True and false questions can be effective if you're trying to ascertain whether or not somebody knows the correct answer and has, in terms of knowledge questions. I would say it's great to have more than just true and false questions so that you can have different styles on there and have some variation. True and false questions could make certain people nervous and could skew the test results, but they're definitely an acceptable type of question. Any other questions? I saw one on there and it disappeared. So if somebody took that off and wants to put it back on there, we can answer it later. Okay. Thanks everyone for your questions.
It looks like we have one more question, Kristen, on what's your take on perception of risk and how to measure perception of risk.
Yeah, I saw that it disappeared for some reason.
Do you want to say anything about measuring perception of risk?
I'm not actually seeing that question, so why don't you go ahead and answer it?
So I would just say that measuring people's perceptions is very, very subject to subjectivity, obviously, and to how people interpret that and what they perceive. But often I think scenarios can give people a way, like Kristen talked about, asking some of the sort of less personal questions as a warm-up. Also, framing things as a scenario or as a third-person example, people can often have a little bit more clear judgment. So if you wrote a scenario about a risk and asked someone to assess on a scale of 1 to 5, how risky do you think this person's choice was? We see that a lot also in some of the role model stories that are used in certain kind of outreach or interventions, and that can be a way, again, to just provide a little bit of that less personal buffer in getting people's opinions. But again, their perception of risk for somebody else may or may not be the same as their perception of risk for themselves. So those are sometimes questions we can ask, a series of questions after a scenario, saying how risky do you think it would be for so-and-so? Have you ever found yourself in this kind of situation? How would you respond? How risky would you think it would be for you? So trying to kind of do the multiple question approach, I think, and creating like a rubric for merging the answers to multiple questions can be a good way to get a more accurate approximation of risk.
Great,
so
thank
Kristen,
you.
I'll turn it back over to you.
Great, thanks. I don't know why some of my questions are popping up and then disappearing, but I am seeing one more. It's how do you feel about sending a pretest electronically to the agency where you will conduct your HIV prevention presentation and having the agency staff give the pretest? As far as sending things electronically, I think that that's great. I just want to be clear that the participants are the ones who need to take the pre and post test, not the actual agency staff. So if you need to send them a copy of the pre and post test and then they print it out and give it to the participants, that's absolutely fine. There's also, if you want to actually administer the test electronically, there are some great sites like SurveyMonkey that you can actually do pre and post tests through, and they actually sort your results and things like that. So that can be really convenient if your participant population is computer literate and has access to computers. So I hope that answers your question. Let's see here. Yes, she said yes, the participants would be taking the pretest and sending them back. Yeah, that's absolutely fine. You know, whatever is going to work best from your program, I trust that you guys will know best what's going to be the best situation. But if sending electronically through email or through another type of medium is preferable, say if you're all spread out, that's absolutely fine. Okay, any other questions? Great. Thanks, everyone. So let's go into styles of pre and post tests. There are many different styles, and we just covered the traditional way of conducting pre and post tests where we take measurements at 2 points in time and compare the results. However, there are some other ways. In some cases, you may just only do a post test, and post test only scenarios are best when program objectives are written to specify what will happen at the end of the program only, as opposed to specifying a desired change or increase between before and after the program. For example, by the end of the program, 80% of participants will be able to ... This is a perfectly acceptable type of objective if what you care about is that by the end of the program, participants have some certain skills or knowledge. If you aren't trying to assess change over the course of the program, you only need to do a post test. Just make sure that the type of pre and post test you're doing is aligned with how your program objectives are written. Another type that's common is called a retrospective pretest, which is what we're going to talk about in the next slide. So in a retrospective pretest, the pretest is not given before the program begins, but rather it's combined with the post test, and both are given at the end. Here, what we want the participant to do is to think about how they are now and compare this with how they were before. This is also sometimes called a post-then-pre design. So let's talk about it in reference to our case study. Here I'm going to show you how the case study questions would look like on a retrospective pretest. So here's the question asking the participant to think back on what they knew before beginning the program. So it says, please check the box that describes how well you knew this information before. And then now we see the same question, only now we're asking how they feel now. So the question is essentially the same, but the tenses are different. So usually the questions will also be right next to each other on the actual test. So here's the other question. Please check the box that describes how well you could do the following task before and how well you can do the same thing now or after. So here's another example of the way a retrospective pretest can be structured. Here we see the answers are side by side, and instead of a checkbox format, we're asking the person to rate themselves on a scale by circling the appropriate rating. So formatting the question in this way on a test can be a real space saver because it essentially combines several questions into one. However, this can be really confusing to some people, so if your population has a hard time understanding this, it's really better to keep things simple and use the checkbox format like we saw in the previous slides. And again, piloting your questions with your target population is a great way to figure out if this question design is going to work or not. So retrospective pretests are popular for a few reasons. First of all, the program starts with learning and not a test, and tests can really turn off some people. Also, we don't have the problem with participants remembering what was on the pretest when they take the post-test. This has actually been proven to influence the answers on post-tests, and this is true especially when the tests are taken too close together. We also ask the person to think about before and after using the same frame of reference. For example, with a traditional pre- and post-test design, a person taking a pretest before the program might rate themselves as being highly knowledgeable or highly skilled on a subject. But then after participating in the program and learning all this new information, they might realize, oh wait, maybe I didn't actually know as much as I thought I did at the beginning. This could actually lead them to rate themselves as somewhat knowledgeable or somewhat skilled during the post-test. And this would actually make it look like the program is having a negative effect on the participant. So we don't want this. So having the participant think about before and after at the same time, it really eliminates that problem. lastly, administering a retrospective pretest can be very convenient because you're really just administering one test at the end. So keep in mind that there are also drawbacks to retrospective pretests. For example, because we're asking people questions where they are rating themselves on their knowledge and skills and not testing them by looking for right or wrong answers, we don't know if changes to knowledge, skill, and beliefs actually happened. Also, remembering back to a previous time period or thinking back on before can actually be really difficult for some people. This is an ability that a lot of us take for granted. So some may have difficulty with this concept because of their age or cultural factors in education. So it's important to think about that. Any other questions? Let's just take a moment. I see a few coming in. Any questions? Oh, look, those looks like those were old ones. Okay. Any others? Okay, let's go ahead and move on then to our last section. Okay, so as mentioned, our final section is about alternatives to questionnaires. So as I've just presented, pre and post tests are most often designed as a questionnaire. However, some people don't like tests, and activities that achieve the same goal as a questionnaire can also be used as pre and post tests. Activities may be more appropriate for some content and for some populations, and they're a great way to show skills learned. For example, actually performing how to put on a condom correctly rather than just writing it out. Activities are also a great alternative for people who can't read and write well, or for people who don't like or are intimidated by tests. And it's also a great way to get people up and moving. Once you've put in the work to decide what your questions will be, you can think about other ways to ask these questions and for participants to give their answers. On the screen you can see some things that alternatives may include, but any activity that is done before and after a program can be used as a pre and post test. Keep in mind that with traditional pre and post tests that are done in a questionnaire format, each individual in the program will have their own score and their own personal change will be reflected. Some of the alternative activities can be done in a group, but this means that the participants may learn from or influence each other. So they're best for measuring group level changes, although many can be adapted for individual use. So card sorting is a great activity for asking knowledge or value questions where there are a limited number of answer choices and clear categories under which to put them. Participants can sort cards into envelopes that are labeled with the categories on the outside, and this ensures that each participant can be scored individually, just like with a questionnaire. Or if you want to see group level changes, the categories can each be written on its own sheet of poster paper. So you have one that says transmits HIV and one that says doesn't transmit HIV. And then the group can decide collectively which cards go on the sheet, and they can be given tape to put up the cards. Temperature gauge activities are great for attitudes or values questions. Here we're doing the same activity as a retrospective pretest activity and asking them to rate how they feel now and how they felt before about the same statement at the same time. For individual level testing, each participant can be given their own sheet with the thermometer pictures and be asked to mark where they were before and where they are now. So the temperature gauge activity can also be done as a group. For example, we could do this activity at 2 points in time, once before the program and once after. The thermometer can be drawn on a piece of poster paper, and each person in the participant group can be given a sticker or a dot to place on the poster paper where they feel that they are represented. This can give us an idea of how the group is improved or not as a whole. If you're interested in keeping track of demographics for your analysis, color-coded stickers or dots can be used. So that's also something really handy about this. For example, you could do males with blue dots and females with red dots, or if you want to further categorize, you could say white males are the light blue dots or black males are the orange dots. You can even code by zip code or residence if that's something that's important to your program. But the important thing to remember is to have as many colors of stickers as you want to keep track of, and to make sure that the participants don't switch their stickers, and of course to make it not obvious that the participants are being coded. Okay, so another thing that you can do as an alternative is labeling. Labeling diagrams can be really, really fun group activity to do. And in this case, the picture is again put up on the wall and participants can tape up the answers. So they can have their labels and you can have a few extra answer choices to make it a little bit more difficult, and then they can decide collectively as a group. Okay, so the last thing we'll talk about as an alternative is observation. Observation can be a great way to do a pre and post test, and it's great for the knowledge or analytic or action questions because it allows people to act out scenarios and demonstrate their skills. So for example, if putting a condom on correctly is something that the participants should have learned during the program, they can be asked to demonstrate their skill at the task before and after the program. In this case, someone would observe the participant showing how to put the condom on correctly and check off which steps they complete. To get everyone involved, you can actually train other participants in the group to observe each other. Either way, it's just important that you have a standardized checklist with all the steps for people to check them off. And if you do this in a group setting, be sure that the other participants in the room can't see each other as they're demonstrating their skills, because each participant could learn from each other, and that would influence the results. Another way to eliminate this is to have people demonstrate different skills so that everyone's doing something a little bit different. And if you use peers to observe each other, such as if you have people go into groups of 2 or 3, you can have each demonstrate a different skill, or you can just count the scores of the participants who demonstrate first. That way you won't include scores that have been improved upon by seeing the people before them do it. So the scores from the pre and post test demonstrations can be compared after the program is over, just like other pre and post tests, and this can demonstrate learning or improvement. Okay, so we're at the end of our presentation. I just want to thank you all for joining us. I hope you've learned a lot about pre and post tests. I'm going to open up the line for final questions and discussion now, so please type in your questions and raise your hands. Thank you, everyone.
While we're waiting for final questions to come in, I'll just say a little bit about some further resources. Kristen's mentioned specifically resources around writing goals and objectives and indicators. We have a recorded webinar on our website that we do about writing goals and objectives. And she also mentioned 2 weeks from now she'll be back to do another webinar in this series with us around writing survey questions. So if you liked that section where she talked about different kinds of questions and which questions are appropriate for measuring which kinds of things, we'll be doing a whole 1-hour webinar on that. If you liked the section of today's webinar that was about alternatives to the questionnaire, so some of the activities like observation, temperature gauges, labeling, card sorting, we have a whole webinar on participatory evaluation methods, and that is going to be the 3rd webinar in this series. It will be happening on January 11th. And then also we are launching tomorrow, actually, an online resource library, which has tons of written materials, links to great online resources, all of our recorded webinars and slides from our past webinars. And there'll be a whole section in there on participatory evaluation activities, a whole section there on writing questionnaires, pre and post tests, and that will be also linked to our website. Also, as we said at the beginning of the webinar, we do individual capacity building. So one-on-one, we can work with your organization or your staff to provide you support for kind of any of those program activities to help you implement HIV prevention programs specifically. So my email and phone number, direct contact information are up on the screen right now. Why don't we do a few questions?
Okay, so I see one here that says, how would you deal with or rate a question that has multiple answers but the client only answers one part of it? So again, this is really up to the discretion of your program. So say, for example, like the body fluids question we had at the beginning, say you want somebody to ideally pick 5 of the correct answers out of 10 possible and they really only choose 1. It would really be up to your program to decide if that person gets full credit for that question or partial credit. or no credit. So it's really going to be up to the discretion of your program, and it really depends on how important it is that they know all the parts of the question or not. Okay, so moving on to the next question, what is the difference between a follow-up interview and a post-test? It really depends on how close it is to the end of your program. If it's immediately following the end of your program, a follow-up interview could be used as a post-test if you're answering if the participant is answering many of the same questions they would have on a post-test, but it really needs to be immediately afterwards. And it really just depends. If you might have a program where doing individual interviews or observation is the style that you've chosen for your post-test, so it's definitely acceptable. But it's different, as I mentioned earlier in the presentation, than follow-up measures. Okay. Okay, here's a question from someone who says that they missed the first section of the webinar. Best ways to analyze data, and wanting to know about how to analyze data, particularly for pre and post tests. That really just depends on the style of your pre and post tests. You may just be rating questions and scoring, and if it's a simple pre and post test, you can do this by hand. If you're doing it on SurveyMonkey, there's ways that you can actually analyze the data through SurveyMonkey. So it's difficult to answer that question without knowing exactly how your pre and post test is laid out. But there are more resources on that. We're going to have more webinars on analyzing data, so I would check back in with the capacityforhealth.org website for more information on data analysis. Okay, and I see another question here. It says, should variables such as gender, age, etc. be included in pre and post tests, and will it help in evaluation of the program? I would say in general, yes, those things can be very, very helpful. It depends on what your program is looking at. If it's important to you to see whether males or females have different, take away different things from your program, you would definitely want to ask about what their gender is on a pre and post test so that you can sort that during analysis. Age would also be really important. Say if you want to know if the younger participants of your program are having a different result than the older participants, you would definitely want to know what their age is. So I think it just depends on your evaluation questions. In terms of funding, this can also be important because sometimes your funding streams might indicate that they want targeting of specific genders or ages. So I would say to just look at what your program is targeting to do and what's in your objectives, and then that will help you decide which demographics are important to ask about. Any other questions from anyone? Or Sonia, do you have anything else to add to any of those answers I've given?
So I just wanted to acknowledge that it is 12 o'clock and our scheduled 1 hour for this webinar has ended. So those of you who need to jump off, please do so. Thank you so much for joining us today for the webinar. Just a reminder that this is the first of a 6-part series. The dates and content, topics of the next 5 webinars are up on the screen right now. And again, just a reminder that we continue to be available for individual capacity building, trainings, other kinds of support. So feel free to contact us via our website or via the contact information that I will put back up on the screen right now. Kristen and I are happy to stay on the phone for a little bit longer. If there are other questions, remember you can click on your raise a hand icon if you want to ask your question live. We're happy to have more of a conversation. And if you want to continue writing in questions in the questions feature, we'll stay on for another 5 or 6 minutes to make sure that all your questions get answered. So thank you again for joining us for today's webinar on using pre and post tests for measuring program outcomes. We hope that you'll join us for our next webinar. Kristen's back with us on December 14th, doing a webinar on writing good survey questions. So thank you again for joining us.
Thank you, everyone.
And, thank you, Kristen, for your presentation. We'll stay on the line if there are other questions.